Hello friends, let us now learn some important points about the next important disease which is seen here, which is a medium vessel vasculitis called as Kawasaki's disease. Okay, this is Kawasaki disease. This Kawasaki disease is most common in children less than 5 years of age. These children, criteria of Kawasaki disease is very important. Criteria, there should be at least 4 out of these 5 criteria should be positive for calling it as Kawasaki disease. So here you should have red eyes, the mnemonic is red, that is there should be red eyes, that is conjunctivitis should be present which is bilateral, and there should be red rash on the skin, and there will be edema and swelling of the skin is seen. And Kawasaki disease is also associated with lymphadenopathy is seen, and this lymphadenopathy which we see is unilateral lymphadenopathy, and there will be mucosal involvement, especially in the form of strawberry tongue is seen, which is called as red tongue or strawberry tongue. So these are the 5 criteria which are responsible for which are important in diagnosis of Kawasaki disease. Then now if you see, the important thing in Kawasaki disease is presence of anti-endothelial antibodies. The anti-endothelial antibodies will be positive, and if you see, there is increase in platelet count is seen in these patients, and this will result in, because of increased platelet count, that means there is thrombocytosis is seen in this Kawasaki's disease. One more important thing about Kawasaki disease is that here in children less than 5 years of age, this Kawasaki disease can cause, because of this thrombocytosis or increased platelet count, it causes thrombosis of coronary vessels. Whenever there is thrombosis of coronary vessels, there will be inflammation, and aneurysm of coronary vessels can occur, leading to MI and death. So we should always be careful while treating the patients with Kawasaki's disease. Thank you for watching.